Imagine going to a mechanic, right? Because your car feels incredibly sluggish.
Oh, yeah, and they immediately try to sell you a brand new set of tires.
Exactly. I mean, they tell you the tread is worn, the grip is gone.
Right.
But the reality is, your engine has been slowly starving for fuel for years. The tires aren't the problem at all.
It's such a perfect analogy because today we are talking about a massive medical misunderstanding.
One that leaves millions of women blaming their bodies for a very similar kind of, well, looseness?
When the real culprit is a completely different, basically invisible organ that is literally shrinking.
Right. It's wild. And we are looking at this fascinating and deeply misunderstood intersection of anatomy, hormones, and sensory nerves.
Because for a very long time, we've just been conditioned to think of the female pelvic floor purely in structural terms.
Yeah, like when you notice a loss of physical sensation in the bedroom or a drop in satisfaction, the immediate assumption is just, oh, the physical architecture has become loose.
Exactly. And the wellness industry just loves to capitalize on that fear, throwing around the term vaginal laxity.
Which brings us to our mission for this deep dive. We are going to completely untangle the complex anatomy beneath that assumption.
We really need to explore this core paradigm-shifting question, which is, can clitoral sensation issues, specifically clitoral atrophy, be completely misdiagnosed as vaginal laxity?
Spoiler alert, yes. And we'll also unpack the quick fix traps sold by the cosmetic industry.
And most importantly, uncover the actual science-backed solutions to repair the system.
Right. So to understand how sensory loss and physical laxity get so easily confused in the first place, we really have to talk about how we visualize the body.
Oh, absolutely. For decades, the two-dimensional textbook diagrams of female anatomy completely failed us.
Totally. I remember those diagrams from high school biology.
Right. Historically, anatomical mapping of female genitalia focused almost exclusively on reproduction.
Yeah, it was all about the uterus, the fallopian tubes, the birth canal.
The pleasure and arousal networks were either heavily minimized or just drawn as these tiny, isolated fragments.
Yeah, they treat the reproductive system like a collection of completely separate parts. Like you have the vagina here, and then floating completely disconnected up top is this tiny little button representing the clitoris.
Which is just so wrong.
Yeah.
To understand how the female body actually creates a feeling of tightness during arousal, we have to look at the three-dimensional reality of the CUV complex.
The CUV complex.
Yes, the clitoridiovaginal complex.
No.
Modern 3D imaging, like MRIs, finally showed us the full picture here.
Thank goodness for MRIs.
Right, because the clitoris is not a small external button. It is a massive Y-shaped organ.
And it spans anywhere from 7 to 13 centimeters inside the body, right?
Exactly. It has roots called crura and these large structures called vestibular bulbs. And those bulbs wrap completely around the urethra and the vaginal canal.
It's literally hugging the entire area beneath the surface.
Yes, it is.
And the sheer sensory power packed into this structure is just staggering. I mean, the external part alone, the glands, contains roughly 10,000 nerve endings.
Just packed into this tiny space, it's an incredibly complex, highly vascular network of erectile tissue.
So the physiology of how that vascular network responds is really the key to this entire misdiagnosis.
Exactly. When a woman becomes sexually stimulated, her nervous system releases specific neurotransmitters.
Like nitric oxide and vasoactive intestinal peptide, right?
Yes, those are two of the primary chemical messengers. When they flood the system, they signal the smooth muscles within the clitoral and vaginal tissues to relax.
Which sounds a bit backwards, relaxing to get tight, but...
Right, but that relaxation acts like opening a floodgate. It allows a massive rush of arterial blood to fill the clitoral erectile tissue.
Okay, so think of those internal clitoral bulbs, the ones wrapping around the vaginal canal, like an inflatable life vest inside the body.
Oh, I love that analogy.
Yeah, so when you're unaroused, the life vest is flat. It's uninflated, so the space around it feels, well, loose. But when you become aroused and nitric oxide opens those floodgates, that life vest inflates with blood. It swells up, it hugs the vaginal walls, and it creates a profound internal pressure.
And as those internal bulbs swell, they physically narrow the vaginal lumen.
The lumen being the empty space inside the canal.
Exactly. The engorgement pushes the walls inward. At the same time, this blood flow results in the extrusion of the glans clitoris, greatly enhancing sensory feedback.
It's amazing.
The entire system basically creates its own internal support and tightness simply through the mechanics of arousal.
which completely flips the script on how we perceive looseness.
It really does.
If your clitoris fails to inflate for whatever reason, say a nerve issue or restricted blood flow, you are
Yeah.
suddenly deprived of that internal swelling. So
Yes.
the vagina would physically feel loose to you simply because the walls aren't being pushed together by those engorged
The
bulbs.
physical sensation is entirely real,
Right?
but it has absolutely nothing to do with your vaginal muscles being stretched out.
It is a failure of the arousal mechanism masquerading as a structural defect.
Perfectly said. And this brings us to the two different saboteurs at play when a patient experiences these symptoms.
Okay, let's break those down.
First, we have true structural vaginal laxity. This is a physical loss of collagen, elastin, and muscular support in the vaginal tissues themselves.
And that's usually from what, childbirth?
Usually as a result of vaginal childbirth, yes, or just the natural aging process, or chronic pelvic pressure over decades. The actual architecture has been stretched or altered.
The scaffolding is compromised.
Right. But then we have the second saboteur, which is clitoral atrophy.
And this is where it gets crazy, because if half of postmenopausal women are experiencing this invisible nerve starvation, but they think their bodies are just loose, that's a massive communication breakdown.
It is a tragedy, honestly.
What is actually happening to the tissue during atrophy?
So clitoral atrophy involves the physical shrinking, desensitization, and even color change of the clitoris. It often turns quite pale.
Wow, just from lacking blood flow.
Exactly. It happens because the organ is being starved of essential hormones and blood flow. This is a major, yet often totally ignored, component of a broader condition called the genitourinary syndrome of menopause, or GSM.
Right, GSM.
Okay.
And that encompasses changes to everything down there, right?
Yes, the vagina, the urethra, the bladder, and the clitoris. Because all of these tissues share the same embryological origin and are just densely packed with estrogen and testosterone receptors.
So when those hormone levels decline, whether we're talking about natural menopause or surgical removal of the ovaries or even the temporary drops after childbirth, the entire environment takes a hit.
A huge hit.
What is estrogen actually doing on a cellular level that causes such a dramatic shift when it's just gone?
Well, estrogen is the great maintainer of this ecosystem. On a cellular level, estrogen binds to receptors in the tissue and signals the cells to continuously turn over and divide.
Right, keeping it fresh.
Exactly, maintaining a thick, robust mucosal layer. It also promotes angiogenesis, the creation and maintenance of healthy blood vessels. So without sufficient estrogen, the tissue literally thins out. The blood vessels retract.
And the natural lubrication mechanisms shut down.
Yes. Furthermore, testosterone, which women absolutely produce and deeply need for sexual health, is a major driver of libido and clitoral nerve responsiveness.
So when you combine the loss of both, it creates this devastating physical and psychological loop.
It really does.
If your clitoral nerves are losing sensitivity because testosterone has dropped, and your blood vessels are retracting because estrogen has dropped, you simply won't get aroused.
Right.
And without arousal, you don't get that life vest inflation or natural lubrication.
Which means sex becomes incredibly uncomfortable.
Or even physically painful due to the friction on that thin tissue. And then that pain signals your brain to avoid intimacy, which kills your libido even more.
It's a vicious cycle. Millions of women are caught in this, thinking their anatomy is permanently broken.
Up to 50% of postmenopausal individuals experience symptoms of GSM.
Yes, and they walk into clinics feeling so much distress, complaining of laxity, and seeking out treatments to physically tighten their vaginal walls.
But the root of their distress is atrophic nerve endings and a starved vascular system.
Exactly. They are trying to treat a symptom while completely ignoring the biological cause.
Which brings us to the vulnerability of the marketplace.
Oh, absolutely.
If you believe your issue is looseness and you're desperate for a solution, there is an entire cosmetic industry waiting to sell you a fix.
And the market for vaginal rejuvenation has absolutely exploded in recent years.
Yeah, heavily promoting energy-based devices, or EBDs. These include like CO2 lasers and radiofrequency treatments.
Right. And the premise behind these energy-based devices is the delivery of controlled thermal energy to the vaginal wall.
Heat, basically.
Exactly. The devices heat the underlying tissue to about 40 to 42 degrees Celsius.
Which sounds really hot.
It is. The intended effect of this controlled thermal trauma is to stimulate the body's healing response, specifically asking fibroblasts to produce new collagen.
Okay, neocollagenesis.
Yes, which theoretically thickens and tightens the vaginal wall over several weeks or months.
Wait, okay. I've seen the marketing for these lasers, and my immediate thought is, How does introducing thermal trauma and burning vaginal tissue do anything to help a clitoris that is already starving for blood and hormones?
That's the million-dollar question.
That sounds completely counterintuitive. We're back to putting new tires on a car with a broken engine.
You're exactly right. The cosmetic approach often completely bypasses the underlying neurovascular deficit.
Right.
If the CUV complex isn't functioning because it lacks hormones, artificially inducing collagen in the vaginal wall will not restore the arousal response, the internal swelling, or the lost sensation.
It just tightens a starved system.
Exactly. In fact, the U.S. Food and Drug Administration actually issued a strong safety communication regarding these very devices.
Really? What did they say?
The FDA warned that the safety and efficacy of energy-based devices for vaginal rejuvenation or cosmetic vaginal procedures are not established. While some very small short-term studies suggest temporary improvement in moisture or perceived tightness, the long-term safety data is lacking. And the thermal burns or scarring are potential risks.
And beyond lasers, there's the extreme structural route, right? Vaginoplasty.
Yes.
This is an actual surgical procedure to excise tissue and physically sew the vaginal muscles tighter together.
And to be clear, vaginoplasty absolutely has a vital medical role.
Right, for severe cases.
For severe, true structural laxity, such as a pelvic organ prolapse, where the bladder or bowel is pushing into the vaginal space, surgery is highly effective and necessary.
Okay, that makes sense.
However, utilizing surgery purely to chase a subjective feeling of looseness or to fix a loss of sensation is incredibly risky.
Because you're cutting.
Exactly. Incisions mean cutting through complex nerve networks. Surgery can result in significant scarring and can actually induce a condition called dyspareunia.
Dyspareunia being the medical term for severe pain during sex.
Yes.
So trying to fix a lack of sensation with a scalpel could permanently leave you in pain.
It's a very real risk.
This makes the diagnostic phase so incredibly critical then. We can't just guess whether a patient has structural damage from childbirth or invisible nerve starvation from menopause.
Right.
How does the clinician actually figure out what's happening beneath the surface?
Well, historically, medicine relied on highly subjective measures, patient questionnaires, and visual exams.
Just asking, how does it feel?
Exactly. But the sources point to a paradigm shift in objective diagnostic technology. One fascinating tool is the genitosensory analyzer.
A genitosensory analyzer? That sounds like something out of a sci-fi medical bay.
It really does. But it's amazing. It removes the guesswork by quantitatively mapping the nervous system of the pelvic floor.
What does that testing actually look and feel like for the patient?
It involves a very small computerized probe, a thermode placed gently on specific areas of the skin, like the clitoris and the vaginal vestibule. The device delivers incredibly precise, millisecond-controlled changes in temperature and mild vibrations. The patient simply presses a button the exact moment they feel the temperature shift or the vibration begin.
So it's literally testing the reaction time of the nervous system.
Specifically, it measures the function of a beta sensory nerve fibers.
A beta fibers.
Right. Our nervous system has different cables for different jobs. A delta fibers, for instance, transmit sharp pain.
Nobody wants those, Tessa.
No. But beta fibers are heavily myelinated, thick cables responsible for transmitting light touch, vibration, and pleasurable tactile sensations.
Oh, okay.
By comparing the exact threshold at which a patient registers these sensations to age-matched normal values, a clinician can objectively see if the beta fibers are damaged or desensitized.
That is brilliant.
If the thermal testing shows a massive delay in sensation, the clinician knows definitively this is a nerve starvation issue, not just a structural laxity issue.
You are literally testing the wiring of the house before you try to rebuild the walls.
Exactly.
So if we have a proper diagnosis, and we discover that the issue is indeed clitoral atrophy and nerve starvation, we can finally look at the real science-backed solutions.
Yes, let's talk solutions.
How do we revive those 10,000 nerve endings?
We approach it from two angles, vascular and hormonal. The most accessible and, honestly, often most overlooked line of defense is pelvic floor muscle training, commonly known as Kegels.
Okay, but we need to reframe how we think about them, right?
Definitely.
Because most people view Kegels as a workout to just tighten the vaginal opening. Like the idea is just squeezing to build a stronger muscle wall.
While they do strengthen the levator antemuscles to provide physical support, their primary benefit for sensation is actually vascular.
Vascular.
Yes. Actively contracting and releasing the pelvic floor muscles acts as a powerful, localized pump.
Oh,
Every
wow.
time you squeeze and release, you are physically forcing oxygen-rich arterial blood into the clitoral and vaginal tissues and flushing out stagnant venous blood.
It was like a heart for your pelvis.
Essentially, this vascular pumping directly feeds the nerve endings and maintains the elasticity of the tissue.
So you're manually doing the job of keeping the blood vessels open. But if the underlying cause is that the body has stopped producing estrogen, pumping blood won't rebuild the tissue on its own.
Right.
That's where hormone therapy comes in.
Yes. Topical vaginal estrogen is profoundly effective for this. And we aren't talking about systemic oral pills that circulate through the liver and the entire bloodstream, carrying broader risks.
Yeah.
We are talking about localized therapy creams, tablets, or small rings placed directly inside the vagina.
Going back to those cellular mechanisms we talked about earlier, when you apply estrogen directly to the starved tissue, what actually happens?
The dormant estrogen receptors in the tissue wake up. They immediately signal the cells to start dividing again.
Like waking up a sleeping factory.
Precisely. Within a few weeks, the thin, fragile epithelium begins to thicken and plump up. The blood vessels that had retracted are invited back into the superficial layers of the tissue.
That's incredible.
The pH of the vagina normalizes, which brings back natural moisture and wards off urinary tract infections. It rebuilds the ecosystem from the basement membrane up.
And for the clitoral nerve specifically,
Yep.
because you mentioned testosterone earlier.
Right. In cases where a patient is experiencing profound clitoral atrophy, where the organ has physically shrunk and libido has just flatlined, specialists will often compound a very low-dose topical testosterone cream to be applied directly to the clitoris.
Directly to it.
Yes. Because the clitoris is densely packed with androgen receptors, this localized testosterone specifically targets nerve regeneration, restoring sensitivity and triggering the brain's desire pathways.
You are giving the exact fuel back to the exact organs that need it.
Exactly.
And there's one final physiological principle mentioned in the sources that ties all of this together, the use it or lose it principle.
It sounds colloquial, but it is deeply rooted in clinical physiology.
Right.
Regular sexual stimulation, whether with a partner or solo, is clinically recommended to maintain pelvic health.
So it's basically a medical prescription.
It is. Consistent stimulation forces the body to routinely practice the arousal response. It triggers the release of nitric oxide, it forces blood into the CUV complex, and it keeps the neural pathways between the brain and the pelvis active.
And if you don't,
If the system is ignored for years, the tissues naturally constrict and the nerve pathways weaken.
it is exactly like taking care of a garden.
Oh, that's good.
You know, you can't just build a tighter, more expensive brick wall around it, like going in for surgery, and expect the dying plants inside to suddenly thrive.
No, they'll still die.
You have to enrich the soil with hormones. You have to ensure the water actually flows to the roots by promoting good blood circulation. And you have to actively tend to it through physical exercises and regular stimulation.
Right.
If you ignore the soil and the water, the garden is going to wither, regardless of how tight that external wall is.
And tying it back to the feedback loop we discussed earlier, once the soil is nourished and the nerves can actually feel touch again, arousal returns. When arousal returns, the natural life festoling happens. The pain disappears. The subjective feeling of looseness resolves itself because the internal anatomy is finally functioning the way it was designed to.
So what does this all mean for you listening right now? The most important takeaway is that your body is not a collection of isolated mechanical parts that just need to be tightened with a laser or a scalpel.
Definitely not.
A feeling of vaginal laxity might simply be your clitoris sounding the alarm. It is a highly sensitive 10,000 nerve network telling you that it is starving, and it needs blood flow, it needs hormones, and it needs active stimulation.
For centuries, medicine and society as a whole have focused almost exclusively on the aesthetic and functional tightness of the vagina.
Yep.
Historically, that focus has overwhelmingly been for the benefit and the pleasure of a partner.
Sadly, yes.
But imagine if we shifted that paradigm. If we spent as much time, clinical research, and cultural energy understanding, protecting, and nourishing that invisible network of the clitoris, how would that fundamentally change our culture's approach to aging, intimacy, and female pleasure?
That is exactly the kind of paradigm shift we need. We've spent so long worrying about the physical structure, we completely forgot to tend to the sensation.
It's time we change that.
Absolutely. Thank you so much for joining us on this deep dive. Keep asking those hard questions about how your body actually works. Look beyond the shiny marketing of cosmetic quick fixes, and always demand better science-backed answers about your own biology. We'll catch you next time.